You have to show the audience?
Oh, you can.
I'm already
You can
recording,
just,
so.
All right, y'all. My name's Lisa Phillips. I'm doing my Capstone project on improving NPO after midnight in adults and pediatric patients for Columbus State. This is my senior project, Nursing 4698, and it is actually due Sunday. Okay. Many patients come to the OR having had something to eat or drink the day of surgery. This presentation will look at the ways to improve that. Okay. That was my introduction. NPO or Nelper os, right? Nelper os, is that what's called? How do you pronounce it? Is used perioperatively for all surgical patients. It is required by anesthesia so that a patient doesn't aspirate during intubation. It's a safety issue for all surgical patients. Okay. My objective was hopefully by the end of this presentation, I'll show show ways that nurses and other healthcare personnel can improve a patient's understanding of what exactly NPO after midnight really means. The rationale for this project was to improve patients' understanding of NPO after midnight, because when patients eat before procedure, it increases the cost to the patient, to the hospital, it delays surgeries, causes surgeons to cancel or postpone altogether, which increases cost to both the patient and the hospital. And it decreases productivity for the OR too. Okay, and then we had to do a PICO question. It says, how can we better teach or educate adult and pediatric patients about perioperative fasting or NPO after midnight? And these are examples of some of the things that we've had patients come in with. You know, they get coffee, chewing gum, hard candy, they don't think any of that's food. So then we have to delay the surgery, you know, by 8 hours or so because they've eaten hard candy and gum. The most often things that patients have had before a procedure are gum, hard candy, and coffee. By eating this, it can delay a surgery by up to 8 hours or longer. This causes not only delay in surgery and more personnel that have to stay and prolong the cost to the hospital, but it also makes patients anxious, frustrated, and angry. So that we got to come up with a better way to give them an understanding of what NPO after midnight really means. One of the researches I did, it was on patients who ate chewing gum right before surgery, and either they didn't tell the nurse, or they swallowed it and didn't say they had it, or they come in chewing it. Well, if they don't tell anybody that they had the gum, when the tube goes down, it can aspirate and cause foreign body. And then they've had an abdominal case where they didn't find out that the gum was there, and when they opened up the abdominal cavity, the gum was there. Well, that causes a whole other issues too. Fasting is really a safety issue. When general anesthesia or sedation is used, it depresses the airway and the swallowing reflex, which is normally used to protect the airway. Anesthesia puts a patient at risk for aspiration, pneumonia, and sometimes even death. There's been some controversy if the patient really needs to fast past midnight, because they say research has shown that pediatric patients in particular have taken in clear liquids 2 hours prior to surgery, and it has shown no risk for aspiration, and it improves the well-being of that patient as well. And it also decreases post-op nausea and vomiting. Okay, there's a rule known as the 2-4-6 rule, and this is brought about by the American Association of Anesthesiologists, The Association of Pediatric Anesthetists of Great Britain and Ireland, and the Royal College of Nursing and European Society of Anesthesia. And they have said that the guidelines say that pediatric patients can have clear liquids 2 hours prior to surgery, 4 hours for breast milk, and 6 hours for solids, which includes cow's milk and formula. It says, although these guidelines are meant to be used, many ORs, especially here in the States, still do the standard NPO after midnight. Nothing to eat after midnight. It says we're slowly learning that, that for the well-being of children, we can kind of fix those problems. Okay. It says, how can we educate surgical patients for NPO after midnight? I came up with a checklist that I thought that we could use like during the pre-op testing if we could implement this stuff. And it looks, that's what it looks like on the screen, but I just did an NPO checklist that we would laminate this and like put it down in pre-op testing and say make sure that you have tell the patient about the NPO status, make sure patients can verbalize what is meant by NPO status, so kind of a teach back. Then make sure you include coffee, chewing gum, and solid food. Make sure the patient acknowledges your understanding of NPO status. And then make sure you give every surgical patient a flyer, which I made up, because I figured a flyer, make it colorful so they'll know. And it says, NPO after midnight. It says no food or drink of any kind, no hard candy, no drink, no coffee, no chewing gum, only allowed a sip of water to drink medications, and I made it colorful. And then just hand this out to every surgical patient. I figure maybe if they have something to go by, it would help. Okay. That's that one. That was a copy of that flyer. The evaluation of the project, if time permitted us to do this, I would use the 2 interventions and give it 6 months to see if it made a difference. I would keep track of, how they're doing downstairs, if they're using the checklist, and then if they're giving every patient a flyer, and just kind of evaluate and see if it works. The expected outcome is to see a significant decrease in the number of patients that have had food or drink before a surgical procedure. It says this will help increase productivity, it'll decrease the cost to the patient and the cost to the hospital. Alright, and in conclusion, many patients arrive to the OR for surgery and have had food or drink before a surgical procedure. Many think that coffee, gum, and hard candy are okay. We need to educate them that eating or drinking cause a safety issue and can cause them to aspirate, which leads to more time in the hospital. By educating staff and patients, we can improve these outcomes drastically. And that's our references. Yay! Thank you.